We have some very interesting topics to cover, not least because of what the Minister had to tell you about his interest and his support for your work.
The best way to ensure that we live long and healthy lives and is the most effective way to keep long-term costs under control. The community pharmacy sector is already playing a very important role in this area and will continue to do so in areas like smoking cessation, obesity and overweight, blood pressure monitoring, and I think there's more capacity there to do a lot more in terms of public health.
Pharmacists are highly trained and highly motivated, and in Ireland they're located in every town and village and community. Their role is far more limited in Ireland than in many other countries, and I feel strongly that it is now time that Irish patients benefit more from what Irish pharmacists can do.
I'd particularly like to acknowledge and recognise the dedication and professionalism and commitment of community-based pharmacists throughout the country. Community pharmacies are at the heart of our primary care system and in many ways are as important as GPs or other professionals. Pharmacists play a really critical role in improving health and well-being in all of the communities that you serve.
Our message is very, very clear. We are ready, willing and able to provide additional services that the public wants. They've told us they want them, but we know will improve the health system and we know that patient outcomes will be improved.
I think the contribution of pharmacists is a very positive contribution. The one thing that pharmacy and GP have in common is that we are the backbone of primary care.
And when I look at the amount of money that we spend on medicines, the investment that the taxpayer puts in the health of their population, it is around trying to ensure we get the maximum value for that, and how we have our GPs and our pharmacists and our patients sharing information in a way that maximises the benefits and minimises the risks attached to medicines.
Okay, we now have a CPD system that equips pharmacists to be trained and to acquire the additional knowledge that they're going to need to take on these new services.
It's an absolute reckless policy and discriminatory that we should be discriminating against GMS patients on emergency contraception and giving it to private patients.
We saved a fortune to the HSE, the department and elsewhere. Please think of us as someone who can manage patients and not prescriptions. Thank you.
It was my first time here, so I didn't know what to expect really, but the CPD lectures were all very interesting and learned a lot from them, and the panel discussion yesterday was excellent. Having the Minister here just made a big difference, felt like he was actually connecting with us.
I thought it was fantastic, educational, motivating, inspirational, some great speakers, great social opportunities and great chance to catch up with old friends and meet new acquaintances.
Great, I really enjoyed the conference. My first time coming to the conference, but I've been making an annual event now every year. Really enjoy catching up with my college friends.
It's great, well worth going to. Met some old friends, met some new people, learned a lot about practicing and lots of clinical knowledge too.
The conference was excellent, some great input, some great continuing education sessions. I think the highlight for me was the Minister and the open forum. It was really, really good to see a Minister come in and be very open and to take questions from the floor.